Treatment of schizophrenia. First, I have to say this is a very important topic, especially for caregivers, because involvement from family and caregivers, like understanding schizophrenia, the treatment options, and what to expect as a part of the journey, gives your loved one the best chance at recovery and stability. It plays a major role in reducing the chances of relapse after treatment. In this video, let's break it down into simple terms. When it comes to treating schizophrenia, you have to remember three things. The first one is medications. Schizophrenia has positive, negative, and cognitive symptoms, and these symptoms are caused by structural and functional imbalances in the brain. So, to stabilize the brain, doctors prescribe medications like antipsychotics. The treatment largely depends on the symptoms and their severity. There are different types of antipsychotics, but let's skip the technical details. What you need to understand is that depending on the symptoms, doctors will prescribe medication and observe how the patient responds and check if the symptoms are reducing or if the side effects appear. Based on that, they will adjust the medication. Yes, it takes time to find the right medication because every patient responds differently. That's why doctors try a few options and adjust as needed. The reason behind this is simple. Doctors want to ensure the best medication with the least side effects. Now, there are cases where some patients refuse to take pills. In such situations, doctors prescribe long-acting injectables, that is, antipsychotic drugs in injection form. That's about medications. The second is psychotherapy. Psychotherapy plays a critical role in managing different symptoms of schizophrenia, whether positive symptoms like hallucinations and delusions, negative symptoms like emotional numbness or lack of motivation, or cognitive symptoms like memory and attention difficulties. Therapies like cognitive behavioral therapy and cognitive remediation therapy helps patients reframe negative thoughts, manage emotions, and improve memory and attention, and strengthen the brain over time. This brings us to the third part: social skills and community support. People with schizophrenia need support in navigating day-to-day life. And for people with severe symptoms, learning how to talk to people and manage emotions becomes necessary. That's why social skills training is included as part of their treatment plan. Family plays an important role in recovery. Family members need to know what their loved one is going through, their patterns of behavior, and how to support them. So, family therapy is equally important. Then comes the professional support and community support. At rehab centers, we follow ACT, that is Assertive Community Treatment. That is when a schizophrenia patient comes to us, a team of professionals, psychiatrists, psychologists, counselors and others, they work together to help the patient recover and manage their symptoms and return to their everyday life. Joining support groups can make a huge difference. Meeting others in the same situation helps the patients and caregivers feel less isolated and provides practical tips for day-to-day challenges. To sum it up, medications and psychotherapy manage symptoms and regulate emotions. Social skills builds confidence, and support keeps things steady. See, schizophrenia is not something we cure overnight. It's a condition that we need to manage the symptoms for a long term and improve their quality of life. In my experience, I have seen many people complete the treatment successfully and manage their symptoms well. Early intervention, the right diagnosis, and the right combination of treatments are the keys to managing it well and living a meaningful and stable life. Thank you for watching.